This is Jeremiah Pfeiffer, and you're listening to Science from the Source. In today's episode, we discuss how manipulating blood flow could allow you to increase gains from resistance training with a fraction of the weight, as I speak with Dr. Brendan Scott, a senior lecturer in exercise science at Murdoch University. Brendan discusses the history of the use of blood flow restriction in resistance training, and then outlines his work, Hemodynamic Responses, to low-load blood flow restriction and unrestricted high-load resistance exercise in older women. This study was published in the open access journal Frontiers Physiology in 2018. Brendan, thanks for coming on the show.
Thanks for having me.
You are an early career researcher here at Murdoch University. You're a senior lecturer in exercise science in the brand new College of Science, Health, Engineering, and Education. And today we're going to talk about your recent article, so your 2018 article, Hemodynamic Responses to Low-Load Blood Flow Restriction and Unrestricted High-Load Resistance Exercise in Older Women. And this was published just last year in Frontiers Physiology. Before we start, though, as an early career researcher, I want to get your kind of take on the PhD process, as well as what it was like for you as a graduating PhD student into a pretty competitive market, and what you did maybe to set yourself apart from other students in terms of job prospects, or how you maybe were just feeling at that point in the first place. And then I'm going to ask you to maybe take a look back and think if you were giving yourself advice 3 years from now, what you might have said to yourself. So if you wouldn't mind just kind of chatting about that aspect of your career so far.
Sure. So I suppose I did an honours degree, as is the standard type of progression into a PhD here in Australia. And I did that with the Central Coast Mariners, monitoring training loads with them. So I guess that was my first little foray into the high-performance sporting world. And that wet my whistle as far as research was concerned. I was pretty interested in answering questions. But when I started my PhD, I had no idea what questions I wanted to answer. I knew I wanted to do research and I was interested in high-performance sports, but I didn't really know how to approach it. So I was working with Associate Professor Ben Dascombe at University of Newcastle, and we started bouncing some ideas around about exactly what I was going to look into. And Ben had a bunch of experience from the practical world as well as research. So he'd worked at the Western Australian Institute of Sport and had seen, I suppose, the practitioner's side of things. And he came up with a few interesting questions about applying hypoxic stimuli to resistance exercise to maybe try to improve responses in the muscle. It's something that he'd played around with just himself with some of the athletes he worked with at WACE, but hadn't actually seen any concrete research looking into it. So I thought, okay, that sounds kind of cool. We'll start investigating that. And it meant that by changing my topic of my PhD from the training load and GPS heart rate analysis with the Mariners I was doing, in my honours, I had a lot of reading to do in the initial stages. I had a lot of catching up to do and trying to wrap my head around some pretty complex physiological processes with like muscle hypertrophy and the signalling involved and all those sorts of things. So I guess my early days of my PhD, I felt pretty overwhelmed, which I guess isn't uncommon for new PhD students. But I think we had a good group of students and supervisors that I was working with at Newcastle. So I suppose we were all in the same boat and we worked well together to try to pursue productivity in research. So I suppose my PhD journey was, I enjoyed it. I found it kind of fun and interesting to be able to answer questions. And I guess fast forward to 3 and a bit years later, when I was almost done with my PhD, I started to realise that my scholarship was going to be up soon and I needed some way to pay the bills. So I was applying for jobs before I'd actually submitted my PhD, when I was sort of in the middle of the last study for my series of research projects, and applied for, I think, 7 positions, didn't hear back from 6 of them. And you, Jeremiah, got in touch with me to say there might be a chance for you to have an interview at Murdoch. And at that point I thought, this will be a great experience, but I won't get the position. And luckily enough, I don't know, someone must have misread my application, but I managed to get through and secured a position here before I'd actually finished my PhD, which was very, very lucky. I suppose to put myself in the best position to be successful in the job market coming towards the end of my PhD or immediately after submitting, I knew that research outputs would be super important for an early PhD grad. So that's something that me and Ben worked on a lot during my PhD to try to make sure that I was coming out with a number of publications and some teaching experience as well, some conference proceedings, some awards, that sort of stuff.
Did you apply so you applied for seven jobs, got one interview, whether you tricked us or not.
Yeah.
But so did you apply, were you only applying for academic jobs? Or, I mean, your honors degree was with Central Coast Mariners, so high performance sport. You came in through a high performance sport program. Was that an area that you were pursuing to go, or did you always think you wanted to go academia after doing your PhD?
I was torn. I could have gone either way. I applied for one of those positions was a postdoc, which at the time I thought was written for me because it was a postdoc in GPS monitoring in the A-League, which is essentially what I'd done in my honours. Thought I was a good shot for that. I found out after that they already had a candidate in mind, as is sometimes the case in sport. So I was willing to go either way, into research and teaching positions or into sort of elite sport. At that time, though, the sort of few months when I was looking to apply for jobs, the ones that I was coming across were mainly academic positions. So I was really applying in the hope of having an interview because that would be a great experience in itself, but to practice putting together responses to selection criteria and wrapping my head around how to address things like university strategic directions, which at that point in my career I had no idea what they meant or why they were important. So I think it was good practice because I ended up getting a job. But yeah, I was kind of torn in terms of which way it would go.
So at the time of your application, and I was on your hiring committee, you had quite a few publications. So you weren't I think you're becoming more of the normal PhD student at the moment. I think that PhD students are being pushed far more to publish, and you're seeing more and more students come out with multiple publications, where it used to be 3 or 4 was really impressive. Now there's this push for 8, 9, 10 out of a PhD. Whether that's correct, right or wrong is irrespective. But you came out with around 17, which was quite impressive. But you're coming into a teaching role. So what was your interest in actual teaching? I mean, did you have an interest in teaching now that you're doing it here? How do you find it? And because it is a big change, I think, for a lot of people who go from a research-focused degree, where your only real job is to do research, to taking on a huge role of teaching.
You know what? I really do enjoy being in the classroom and teaching students. I enjoy engaging with students, and when they do get something from the courses I teach, that's kind of motivating for me to continue to try to teach well and to impart some knowledge on them. Of course, there's all the administration and whatnot that goes along with it, which maybe isn't so fun. But I had a bit of experience at Newcastle teaching mainly lab classes, some lectures, and I knew that I enjoyed teaching. I still do enjoy teaching, and I kind of now like the challenge, I guess, of trying to structure whole courses and more the, I guess, coordination aspect of it, of structuring courses in different ways to improve learning outcomes and taking different sort of approaches for the students and trying to work on things like student engagement, get more students to actually turn up and to want to learn. So, yeah, I do enjoy teaching. It had always been something, like I said, in the back of my head that I would like a teaching, research, academic type of position. If I got a job in the early days in sport, that would have been okay. But I think a lot of people, particularly in the early phase of their career in sports science, try to get into the sporting side of things initially with the knowledge that the fallback and maybe a bit more job security will come from working in academia, where you have still the chance to engage with sport and undertake research, but maybe a bit more stability in your position, which comes from the fact that you have to teach undergraduate students. Okay.
And so before we head into the actual bulk of this interview, the last thing I want you to maybe comment on is if you could see yourself, 3 or 4 years ago, right? You go back in a time machine and there you are, Newcastle, and you can give yourself maybe like 2 or 3 pieces of advice. Now knowing what you know about academia, having been, you've gone from lecturer level B to senior lecturer fairly quickly. What advice would you give yourself? And really what I'm asking is, what advice would you give another PhD student who might have been in a similar position as you?
One important thing that I'd never really considered from the university perspective was grants. When I did my PhD, it was I had enough money to do the studies I wanted to do, so that was all well and good, and why would I need to apply for funding I didn't really need? But I know now that from the university's perspective, securing particularly external research funding is very important. So that's something I would have liked to considered earlier, getting better, getting mentoring from people who were successful writing grant applications, getting a better knowledge of just the funding landscape, particularly in Australia, and just knowing what schemes are out there and what I would be suited to apply for. And I suppose along the same sort of line with that is understanding that high-performance sport research is really my passion. That's what I'm really interested in. But from that sort of funding perspective and from strategic directions of universities and general impact of research for a broader scale, it's important for maybe in sports science or exercise science to have some sort of a health slant or something that can be applied to broader populations and have a more far-reaching impact, because that will help with grant applications. It will help provide maybe some increased breadth of your knowledge and your reach. So they're probably two things I would consider. Think about funding and think about maybe some more impactful research.
Great. So I want to transition to the point of today's interview, beyond your experience as a PhD student and now as an early career researcher, but your expertise or background, right, we'll call it your expertise, is in blood flow restriction. If you asked me about this area about 3 years ago, I would have had no idea what you're talking about, and I don't think a lot of people would know what blood flow restriction is. And so maybe you can just give kind of a discussion around what it is you actually do, what the purpose of it is, what are some of the things that the research suggests, and then, of course, we'll talk a bit about the paper you published last year, as a final point.
Right. Well, you've probably heard me say these things before, because when I first came here, I basically had to give this spiel and explain to you what I was going to do and how it wasn't dangerous and we weren't going to kill people in the lab. So blood flow restriction training was developed in Japan, first developed in the 1960s by a guy called Dr. Sato. And the story goes, it's kind of a funny story, that he was starting to take up bodybuilding and he was in a prayer hall and he was kneeling down and he started to sense that his calves were swelling. And he thought, this feels similar to the pump I get when I'm training, and maybe it's due to changes in blood flow. So he thought, well, maybe if I can change blood flow, I can get that same sort of sensation and get the same responses as when I lift weights in the gym. So he started mucking around in the 60s and into the early 70s with occluding or reducing blood flow. With some early success and some ill events, he was hospitalised at one point with a pulmonary embolism, which of course is not a desirable response to blood flow restriction training. But he ended up coming up with what he thinks is a good system. It is, I suppose, that they do a lot of good work in Japan, to restrict blood flow to working limbs during low-intensity exercise to try to improve the responses we get in the muscle. So what we understand now is that we want to apply pressure via small cuffs, so very similar to a thin blood pressure cuff to either the top of the arm or top of the leg, depending on if it's upper or lower body exercise we're doing. Typically, you'll do resistance exercise and you set the pressure so that we're allowing some blood into the limb, but we're occluding venous return. And we can do that because veins are generally smaller and less robust when compared to arteries. They don't have the same sort of muscular structures, so we can clamp down on veins with the same pressure that allows blood to flow through arteries still. So if we set blood flow, changes in hemodynamics or this pressure in this way, we can essentially cause a pooling of the blood within the limb, or we can trap some of the metabolites within our muscles that occur during exercise. So the way I explain to people who've never heard of blood flow restriction, what it's really trying to do is it's taking a very low intensity or a light physical training session, so lifting very light weights or walking on a treadmill or cycling very slowly, and by changing the blood flow parameters within the working muscles, it makes it a more physiologically demanding stimulus. So you upregulate the potential of those muscles to adapt to what normally wouldn't be an adaptive type of stimulus or a strong driver for adaptation.
So when you say lightweight or low resistance, give me an example, like a real world example. So if I go into a gym, and for anybody who's listening to this, and most people have been to a gym or lifted, or at some point in their life may have lifted weights, most times you go to a gym, you're prescribed 3 sets of 10. The weight is standard, relatively heavy, but that's pretty standard technique. So what would you use normally, and then what might you use in terms of blood flow restriction for, let's say, something like doing a squat?
Right. So blood flow restriction really targets increases in muscle growth. The neural adaptations to strength are a different conversation, but it's focusing on muscle growth. So to train normally without blood flow restriction for those hypertrophic responses, you're going to lift moderate loads, about 70% of your 1 rep max. So that's about the 1 rep max is the heaviest weight you can lift for a single repetition. So for example, with a 1 rep max, with 70% of 1 rep max, you might be able to do 10, 11, 12 reps before you completely fail. So it's pretty heavy, but you can do a decent set as far as the volume of reps is concerned. Now for blood flow restriction, if you're going to do the squat exercise we talked about, to make it easy on my maths, let's say your maximum squat that you can do is 100 kilos. If you're training for hypertrophy unrestricted, you might do 3 sets of 10 following that scheme you mentioned with 70 kilos. And if I was going to do it with blood flow restriction, I might use 20 kilos or 30 kilos, 20 to 30% of 1 rep max. But because the weight's much lighter, you have to do more volume. So there's a inverse relationship between volume and the load. So you might do 30 repetitions in the first set, then 15 reps in the second, 15 in the third, for example, as opposed to 3 sets of 10.
So what if you didn't have the blood flow restriction on at all, though, and you wanted to try to get the same muscle growth by lifting the same low weight? Would you need to do 200 reps? Could you even get the same muscle growth from that low weight?
Yeah, so Stu Phillips at Murdoch University over in Canada, he's done a bit of this sort of work out of his lab where they've looked at taking low weights sets to failure and found substantial growth with weights, again, that you normally wouldn't see growth responses using if there wasn't blood flow restriction in place. So what some people are thinking is that it's probably more to do, or growth might be impacted by how close you are to failure during a set of resistance exercise. And it just happens that with heavy weights, you don't need as many reps to be close to failure. With light weights, with blood flow restriction, you need more reps. But without the restriction, you need more again, because the blood flow restriction, of course, decreases performance. It's a stressful stimulus.
So I guess then the question that you might ask is, what's the point then? So why then do blood flow restriction? We know that we can use low weights and we can just do a whole bunch of reps to failure, and that can mimic the same response as doing a heavy weight, 3 sets of 10. Why then incorporate blood flow restriction? What's the benefit of doing that over just having someone do a whole bunch of reps?
Yeah, that's a good question. And my answer to that is that doing a whole heap of reps to failure sucks. No one wants to do that for 1 set, let alone 3 sets each exercise every time they come in to train. It's just really demanding and physically, and begins to become very demanding mentally as well. It's hard to motivate yourself to go to failure every single rep. And I suppose that's where blood flow restriction comes in, is it means you don't have to do as much. You don't actually have to go to failure. Although it's a different type of sensation. We can maybe discuss that after. But it takes that out of the equation. Another thing that I think is important to consider is by lifting these light weights, people propose that blood flow restriction has a lot of applications for people who can't physically tolerate the high mechanical stress associated with heavy weights. So if someone's recovering from an injury, for example, they're not mechanically able to lift heavy loads, so they can lift light loads, maybe use blood flow restriction, get some benefits. If they were then to lift light loads without blood flow restriction, but then go to failure, well, you sort of circumventing that decrease in mechanical load by taking someone to failure. You're not really getting at that complete deload, which you're trying to achieve in the first place by lifting lighter weights. It's possible to get responses, but it'd be a once in a while kind of thing, and maybe something that's just interesting to see in the lab.
So with that said, is this a technique that's used then, in a rehab setting? So you're talking about people who might not be able to lift heavy weight. So my first thought is someone maybe who has an ACL reconstruction and they come in and they're strengthening their lower limbs. Would this be something that's being used now, or is it still kind of in the phase of finding out what the actual outcomes are, and so it's not really making its way into rehab settings?
Yeah, there was actually a paper published, one of the first papers in the BFR literature in 2000, using ACL reconstructive patients as their participant cohort. And so there's a number of papers that have done this since. So it is out there. It's not mainstream by any stretch, and probably if you go to most orthopedic surgeons prior to having ACL reconstructive surgery, they'll tell you you're nuts if you're going to do this stuff, because there's just not information out there about it in those circles. But there's some nice research that's shown you can use blood flow restriction during the recovery phase following ACL reconstructive surgery, where they're really in that force compromised situation as far as not being able to tolerate heavy loads, so they can benefit from doing their relatively easy from a mechanical point of view light load exercise by adding BFR. But also the disuse atrophy that you get from periods of bed rest, or there's some research that's used cast immobilization to essentially lose less muscle mass, so you've got less to regain during your rehabilitation process. So even just applying blood flow restriction by itself in the absence of any exercise, so you pump the cuffs up for 5 minutes, take them off for 3 minutes, up for 5 minutes, off for 3 minutes, sort of continuously cycling between pressure and pressure relief. That attenuates the disuse atrophy. Not completely, you still get a little bit of wastage, but far less wastage than you would get just being in a cast or immobilised for a period of time immediately following surgery.
I mean, I would assume then if there's a specific population that might be super interested in that aspect, it's probably athletes and probably professional athletes who need to come back from injury quite rapidly and need to be conditioned well. And so losing muscle mass is probably a negative for them. Is this technique being used within the field?
Most professional sporting organisations that have dedicated sports scientists are sort of across this and aware of it and starting to implement it. And I've spoken to some sports scientists that have used it in exactly this way in rehabilitation processes following injuries for athletes. So, for example, one athlete coming back from the Rio Games over here in WA had a tear of the long-headed biceps tendon, I think it was, off the scapula, and it was stitched back down onto the humerus, so that tendon was relocated. During this rehabilitation phase, the athlete, of course, was force compromised, so they couldn't lift heavy weights. They did bicep curls because it was a bicep injury, using only 2 kilos, so very light loads compared to what the athlete could actually lift. And they did their other normal training on the opposite arm, and following a couple of month intervention, the group that was doing this measured muscle mass using DEXA, dual energy X-ray absorptiometry, to try to have some sort of assessment or data to indicate whether or not it was beneficial. And there was very similar increases in muscle mass on both sides. One side lifting heavy weights, the other side lifting very light weights immediately following reconstructive surgery for a tendon. So, yeah, it is that's just one case study, but it is being utilised in high-performance sport for rehabilitation purposes.
All right, so and maybe in some more low-performance sport, I know that you had shoulder surgery about a year ago, and I know that you also tried to use this technique a little bit. So, not only as a practitioner but a user of the technique, what were your impressions of how it helped? Did it actually help you? Did you find it being beneficial, or or did you not have enough time to dedicate to actually doing it enough?
I probably didn't do it as much as I should. I did use blood flow restriction in the acute rehabilitation phase, but I didn't take any sort of specific measurements to determine with any sort of scientific rigour whether or not it was being beneficial or not. I suppose all I can say is that my shoulder recovered quite quickly. The surgeon was very happy with it at the follow-up appointment a couple of months post-surgery. And I've got no issues with it now. So I suppose it got to the endpoint that I was hoping to get it to. I guess what you're trying to do by implementing the blood flow restriction during these type of rehabilitation phases is just speed up the recovery process so you can return to function faster. Hard for me to say whether or not that happened, but I would say, with my understanding of what actually happens in scientific research, it probably did improve the rate at which I was able to get back to function.
Now, let's say I'm at home, I'm listening to this, and I think, well, I'm going to go to the gym and I want to do blood flow restriction. Firstly, I guess a couple questions. Should I just start doing it? Second, if I decide to start doing it, would I go about it? And third, once I get all the stuff I need, how hard do you need it to? So you might think of putting a rubber band on your finger and watching your finger turn purple, right? So the question is how hard do you need to compress the limb to get the necessary blood flow restriction? So not purple is the answer. Okay,
not purple's a way to start with that question. So first of all, I'll address the first part with should everyone do it? No, I don't think so. Blood flow restriction works. It provides a stimulus for muscle growth, but so does just lifting moderate weights and training as per normal. So if you're capable of lifting normal loads to improve muscular strength and size, well, then I would say that's still the best approach. There's certain conditions or people with contraindications to compressing the vasculature where I'd be really concerned. So, for example, we'll touch on the findings from the study later, but it sort of comes into this argument I'm about to make. People who have hypertension, for example, already have elevated pressure within the vasculature during exercise. Then if we clamp down on the vasculature and further exacerbate those pressures, it's potentially going to compromise those blood vessels. People who have a history of clotting disorders, if you've, even though it's a rehabilitation type of tool, if someone's rehabilitating from a stroke, of course we're not going to use these type of approaches because there's compromised vasculature that could be further compromised from using this. So no, it's not for everyone. I would only use it for, at least with our current understanding of the safety, apparently healthy people who have some sort of physical limitation. Typically it's going to be something orthopedic that precludes them from lifting heavy loads or undertaking very high intensity training stimulus. So if you are one of those people and you can undertake blood flow restriction, there's a number of ways you can do it. So in the lab here, we try to take a very scientific approach and we measure the exact pressure required to completely occlude blood flow, and then we use a relative percentage of that during our training sessions. So if we think about requiring a certain amount of pressure to completely cut off blood flow, we might use 50% of that during our training. So we're going to be sort of sub-maximal. So that, I suppose, gets to your pressure question. If you don't have the equipment and the expertise to do that, there's even research that's used what they call practical blood flow restriction, just wrapping powerlifting knee wraps around the top of the arm or top of the leg. And it might seem a little bit sort of bro-sciencey just to take your powerlifting knee wraps and wrap them around your legs and then do knee extensions or whatever it might be. But this was sort of pioneered by a guy called Jeremy Lenicky he's at the University of Mississippi now in the States. He's the guy that's probably published most of the papers in this area, and he's published a number of studies taking this approach, and they've found similar acute responses by using this practical blood flow restriction, just wrapping the wraps around your legs, compared to more scientific approaches with really individualized pressures. So you get the same changes in hemodynamics, so blood still going into the limb but not coming back out. You get similar increases in metabolic stress, changes in muscle activation, which is a consequence of the metabolic stress. So you get more motor units being recruited. So it seems that people can apply the right sort of pressure using these cuffs just wrapping around the top of the arm or leg. And the way they do that is based on perception. So if you think about a scale of 1 to 10, with 10 being intense pressure that causes pain, 1 being almost nothing, the cuffs are wrapped so loosely they're about to fall off your leg. For this practical blood flow restriction, you apply it at about a 7. So it's moderate pressure but no pain. And when you've got that wrapped there with a little bit of experience, a bit of trial and error, if you can complete what we refer to as a standard repetition scheme, so 20 to 30% of your 1 rep max, you do 30 reps in the first set, followed by 3 sets of 15. If you can get through that, but it feels quite tough towards the end, and you've wrapped these cuffs using the practical approach, then you're probably at about the right pressure because you know the load is appropriate, you know that the weights you're lifting are relative to what you should do with blood flow restriction, so that the pressure must be right. If you can't do that many reps or you get nowhere near it, the cuffs are probably too tight. And if you do it and it was a breeze, it was too easy, they're probably too loose.
Okay. And then you mentioned before, and we're going to transition to the actual study in a second, but you mentioned before the idea between muscle growth and neurological changes. And so, maybe quickly explain the difference between those two things for someone who may not understand resistance training and what benefits you might get, and then how each of those benefits might help someone or enhance performance or function.
Right. So if we think about strength or increasing strength, that's really the end point for a lot of people with resistance exercise, right? We lift weights so we can eventually lift heavier weights. And there's 2 ways that we can get to that point where we lift heavier weights. We can, number 1, grow the muscle. So we have essentially more contractile tissue to pull together to bring a muscle to become a shorter length and contract or change the limb angles. And that allows us to exert more force because we have more muscle. So that's really how blood flow restriction works. It increases the size of the muscles. The other is basically by improving how we can drive our muscles from our brain. So there's a number of neural adaptations that increase the amount of motor units we recruit during exercise, increase how quickly we can recruit them, turn off some of the motor units that are going to be working in opposite muscles. So if I'm trying to contract my biceps, for example, when I'm just a beginner to exercise, muscles or motor units in my triceps will be trying to fire off. As I become more accustomed to exercise, everything begins to coordinate a little bit better, and I can just essentially keep those motor units that aren't necessarily wanting to be recruited quiet, and that allows for increased force production. So the optimum way to get as strong as possible is to have the muscle growing and also have these neural adaptations occurring at the same time. But the kicker for blood flow restriction is that because the loads are so light, we don't see potent neural responses because they're really driven by lifting heavy loads and lifting loads as quickly as we possibly can. So that's what I was getting to before when I said that if you're capable of lifting heavy loads, then you should, because then you'll really drive some of those neural adaptations as well as the potential for muscle growth. And if we think about from an athlete's point of view, they want to be faster and stronger and more powerful, right? It's not always about increasing the size of the muscles. Bodybuilding is probably about the only example of a sport where it's really down to having bigger muscles. So yeah, for the most part, from an athletic point of view, performance will be enhanced by the capabilities of the muscles to express force. And even if we think about a completely different population, older people who might do resistance exercise, they're not trying to be bulky, right? They're trying to be able to get up out of a chair with more ease, be able to walk up a set of stairs without feeling like they're going to fall, be more stable on their feet if they're walking on an unstable surface because they know they have the muscular power to quickly move their foot out to right themselves if they start to lose balance. So that's really the end point and what I would say should be the training goal for most people.
Okay. But if you use something like blood flow restriction, then the ultimate outcome is growth. Right? So, final question is, I sleep on my stomach and my arms fall asleep every night. Why are they not gigantic? So if I'm restricting blood flow to my arms for 12 hours a week, yeah, okay. So that's not the way it works. So you actually have to maybe lift some weights at the same time. All right. So we're going to transition now into the study, and I'm going to read out the title once again because I think I slaughtered it the first time. So it's a 2018 paper in Frontiers Physiology, and the title was Hemodynamic Responses to Low Load, Blood Flow Restriction, and Unrestricted High Load Resistance Exercise in Older Women. You touched a bit on this a few minutes ago about different populations and how right now it's being used for athletes, or it's been primarily used for athletes, or kind of focus on that. And more it's being used in rehab settings, and now maybe with older adults to combat some issues with muscle mass, muscle atrophy with aging. And so you've run a study where you've looked at its impact on older women. And so what I would like you to do for the next couple of minutes is just kind of walk us through your thought process on, one, why you undertook the research, and then you can maybe just walk us through the study itself. What did you do? What were the outcomes? And then some general thoughts, and along the way, I'll ask a few questions about that.
Right. So the motivation for doing the study was really born out of trying to understand the safety concerns, maybe around blood flow restricted exercise for older people. Because if we think about older people sometimes being force compromised or having benefits to be gained from lifting lighter weights but still getting increases in muscle size, well, older folks often have other contraindications that would mean maybe it might not be the safest technique for them. So we wanted to understand the hemodynamic and cardiovascular responses that occur in older women using blood flow restricted exercise. So that's, I guess, the main question we wanted to answer. But we wanted to go at it from an ecologically valid point of view in terms of using or making comparisons between this blood flow restricted exercise and, I guess, the best case scenario of lifting heavy weights in the gym, because it's all well and good to compare light load exercise with blood flow restriction compared to without. The blood flow restriction condition is always going to result in increased physiological demand, but I think it's important to compare that to high load exercise, which is really what people are trying to get to get the optimum responses. So we made the comparisons. We had three conditions in this study. So a low load unrestricted group, low load with blood flow restriction, and then high load. So this is that sort of 70% hypertrophy type of training regime. It was an acute study, so we're just looking at the responses during and immediately following the training session itself, not the adaptive responses over a period of exercise. So we recruited these older women to come in. They did maximal strength testing, of course, for the leg press and leg extension exercises we used, because they're exercises that are commonly used in these sorts of training programs for older folks. And we randomised them in terms of the order that they'd run the trials through. We assessed basic measurements of blood pressure for the hemodynamic responses. We took some perceptual responses, and we also assessed some more detailed cardiovascular function. So in terms of what we actually found, Well, probably the blood pressure responses are the easiest ones to think about. When we looked at the high load and the low load, both unrestricted conditions, very similar blood pressure responses between those two groups. And you might automatically think, well, lifting heavier weights should cause higher pressures within the vasculature. We didn't see that, and probably because the low load group performed more repetitions. So lifting more reps with a lighter weight induces roughly equivalent hemodynamic responses as far as the pressure in the vasculature. But the blood flow restriction condition had substantially greater systolic, diastolic, and of course mean arterial blood pressures than both those conditions. So higher than even lifting heavy weights, which might be concerning for some people. As I mentioned before, if you already have high blood pressure, you suffer from hypertension, and then you're going to add further to those pressures in the vasculature by adding blood flow restriction. It could put you in a potentially dangerous situation.
So on that point, though, just maybe to clarify, these were healthy adults when they came in, right? So
Correct.
You weren't using people who had hypertension, so
No.
the increases in blood pressure there, while considered high, how were they, I mean, in the realm of what you considered normal? So I think you make a point in your paper about where they sit compared to a maximal exercise test or a ECG stress test where you might see blood pressures. So were they as high as those blood pressures, or are they higher than those blood pressures?
No, so they weren't at a level that might be clinically meaningful in terms of something to really, really be concerned about. So, for example, the diastolic blood pressure, I think, got to about 83 or something of that nature, in around that. And that was an increase from baseline, which the two unrestricted groups didn't see. So, yeah, maybe something to think about, but still probably not to a level where you'd be really super concerned with people undertaking this exercise. There is a couple of studies that have looked at, the only other studies to use older women and look at acute hemodynamic responses have recruited hypertensive older women and saw very similar responses, and even the magnitude of the response was quite similar to what we saw. Might be due to the fact that these older women in those studies were also on hypertensive medication, so some sort of control for the blood pressure. But yeah, it may be something to be wary of. Perhaps not the huge call for concern that lots of people put out there in terms of blood vessels are going to explode because we have so much pressure in them, but definitely something I would be wary of moving forward with someone who had hypertension.
So you saw changes in blood pressure. What else did we see?
No real differences in terms of the other cardiovascular variables between the blood flow restriction and the high load exercise group, which is the main comparison I was interested in. So heart rate, for example, is a simple one that most listeners will be familiar with, almost the same between the restricted low load condition and unrestricted high load. Both of those, though, were higher than the unrestricted low load condition. So essentially that's indicating that the blood flow restriction adds some additional physiological stress onto the low load exercise, maybe to bring it up to about the same level of demand as high load training, at least in some of these measurements. Now, when we compared the leg press to the leg extension exercise, we saw that the leg press was substantially more stressful than the leg extension, probably due to the fact that there's just more muscle mass involved. And as a consequence, people were lifting much heavier weights. So whether or not that's a call for concern and people shouldn't do leg press because it's too stressful in the cardiovascular system, I don't think that's the case. But again, maybe something to just be aware of, that the choice of exercise as well as what modality of exercise makes it an impact in terms of the demands that it will place on an individual.
And you said you took perceptual responses. So were there? How did they? I mean, I'm assuming that this was probably the first time these people had ever experienced blood flow restriction as well. So what was some of the perceptual responses to that?
So maybe I'll touch on just some anecdotal stuff before we actually get into the data from the study. So the first time people do blood flow restriction, I think it's important that if you're doing it in a research or even a clinical context, explain to them what they're going to feel, because it feels quite different. I know you've tried blood flow restriction yourself and relayed some of your thoughts to me. The easiest way I can explain it maybe to listeners that are unfamiliar with BFR exercise is that burning type of sensation that you get towards the end of a set of exercise. So say if we think about bicep curls, as you get towards the end of a set of bicep curls, you get that burn in your biceps, and you put the weight down and shake your arms and that burn goes away and, that's okay, I'll start my next set in another 60 or 90 seconds or so. When you use blood flow restriction, that burn doesn't go away. And in fact, it can feel a little bit worse in the recovery period between sets. And really what we're sensing there is the metabolic stress, the trapping of these metabolites, which create a more acidic environment within the muscle. That's probably important for the adaptations we see, but creates some maybe uncomfortable sensations, particularly when you first try it, because it's just quite foreign. And it probably feels worse, I think, during the rest periods between sets for resistance exercise, because you don't have any movement or exercise to distract you. And also, along with that, the blood during the exercise sets is still going to be moving around, so those metabolites aren't sitting in the exact same spot, which they might be a little bit more stagnant in the rest periods between sets. So that's something that's important to think about as well, as you'll get a really insane sensation of the muscle pump. It feels quite swollen, and that's really the swelling response that we're looking for. We're allowing blood into the limb, not allowing blood out. So, of course, the muscle and the limb is going to feel swollen. So they're things I would tell people to expect to feel during the exercise. When we actually got into the study itself and we used ratings of perceived exertion to try to understand how our participants were perceiving the difficulty of each set and the entire session itself. Of course, the low load unrestricted condition was perceived to be the easiest. That's a bit of a no-brainer. Similar when we think about the session rating and perceived exertion. So we asked participants overall, how hard was that training session? Relatively easy for the low load unrestricted, and very similar between the blood flow restriction and the heavier load condition. Something interesting that we saw, and we'd probably have to look into this a little bit more detail with further studies, was when we asked people after each set, how hard was that set of exercise, those 10 reps or so that you've just done, there was a faster increase in how difficult participants found it when they used blood flow restriction than with the unrestricted condition. So essentially we had a steeper gradient of this exercise became more and more difficult each set for blood flow restriction. And I think that might be due to the fact that because we use what we call continuous blood flow restriction, so we're not releasing the cuffs between sets to really try to get that metabolic response and the accumulation of blood and metabolites. Because that's all being trapped in there throughout each set, it potentially exaggerates those sensations of fatigue. I'll use that term in inverted commas, or the perceptions of that sensation of the burn that I was talking about before. It might be exaggerated because we're not releasing the cuffs between sets. So that's something that's kind of interesting. When I looked back through a couple of other papers that I did find one or two studies that actually had shown that, but not really ran statistics on it. Just sort of, they saw larger increases in the rate at which people perceive the difficulty of blood flow restricted exercise compared to lower load and higher load unrestricted training. So I think that's maybe something that could warrant a little bit of further investigation.
Okay, so and that might have an impact on the way that blood flow restriction training is applied or prescribed within the field. Yeah. Another area that I wanted just to discuss about prescription was within the paper, you did find some differences in rate pressure product. And so for people who don't know what rate pressure product is, it's really the work the heart's doing, the myocardial work. It's heart rate times times systolic blood pressure. So it's like lifting weights. It's like reps in weight. And you found it to be a little bit higher in the blood flow restriction trial because, of course, the heart rate response was the same as the high intensity trial, but the blood pressure was slightly higher. I know you're speaking in theoretical terms here, but what do you think that means in terms of, so a practitioner working in the field using this technique, do you think that's an issue? I mean, do you think it would be an issue, especially working with older adults or with someone who might predispose to cardiac
heart disease yeah, I think that's something that should be in your screening tools. Like, you should always screen before anyone does any sort of exercise, and there's probably some specific questions to ask prior to blood flow restriction itself. And any sort of heart disease or cardiac dysfunction, I'll use a sort of catch-all term there, I think people should be screened out at this point at least, because we just don't know enough about the potential impacts on the heart. The vasculature, we have a fair idea that's going to be stressed. Some studies show sort of this rate pressure product is increased with blood flow restriction. Some don't see the same response. I think it's Resistance exercise is kind of a tricky one, particularly comparing across studies because there's so many variables you can manipulate, the number of reps, the number of sets that you do, the rest period between sets, how quickly you lift the load, what type of exercise, like a leg press compared to a leg extension where you're changing the posture and therefore altering hemodynamics due to gravity itself. There's so many moving parts that it's quite difficult to get consensus between a lot of studies. But yeah, you're right. I would be cautious with anyone that presents with cardiac issues or a history or maybe a family history even of that being an issue.
Okay, so currently then what we know is that it works. I say most likely works because we've written a few papers together that have shown that it hasn't. And so whether that's our science or whether that's just actual it's not working is beside the point. But it may, at this point, we don't know enough to say, look, across the board, go ahead and use it or don't use it in certain populations. So maybe take a more cautious approach to the implementation of it.
Yeah. And I think as researchers, we're always going to be a little bit cautious because no one wants to be the first researcher that designs a study or makes recommendations and hurts someone.
Fair enough.
Not because, not even just that you don't want to have that reputation. We don't want people to become hurt as a consequence of implementing some sort of novel strategy that we've tried to put forward. So yeah, I think there's lots more that needs to be done from the safety point of view. But what I will say is that the studies that have tried to address the safety aspects of blood flow restriction haven't really seen anything to be hugely concerned about. Like maybe some things where I know this type of person, someone with ischemic heart disease, probably shouldn't do this type of activity. But nothing sort of large scale that would say, oh, this is super dangerous and shouldn't be implemented. There's even a couple of studies now, 2 big surveys that were done, one in Japan, 2006, I think it was, and another worldwide about 2 or 3 years ago. It was published by Stephen Patterson out of St Mary's in the UK, where they've looked to basically survey people who use blood flow restriction or practitioners who've implemented it and get some sort of a snapshot of the prevalence of certain kinds of ill effects. And they're very similar to normal exercise in the gym or sports. So even though people propose, oh, this is super dangerous, we're cutting off blood flow and making people go to the gym, the actual incidence of ill effects isn't as high as you might expect.
Well, we have a few minutes remaining, so I have 2 final questions for you. The first question is really to get a sense of where you're going with this blood flow restriction research. And so I don't expect that you highlight and outline all your future study plans, but where do you see yourself going in the future? And whether it's down 2 lines of research, sport performance and health, and where do you see yourself in maybe 3 or 4 years with this kind of line of research?
You can tell that we work together because you've just outlined the 2 directions.
I'm outlining my direction I want you to go so that I can continue to get publications. But yeah, so where do you see this kind of technique going?
So I think, particularly from the perspective of older people or rehabilitation type of settings, there's a lot of talk around, this is a great technique for people who are force compromised and could benefit from lifting lighter weights and still getting muscular growth or whatever it might be. But there's very, very limited research in terms of the actual functional outcomes. And if we think about older folks, for example, they don't care about, as I mentioned before, having huge biceps. They care about being able to get up off the toilet and being able to walk up and down stairs and being able to walk to the door to answer it if someone comes to call. So the actual functional outcomes for older folks after blood flow restricted interventions, I think is something that's really important. So that's an important thing to investigate. But also I think from the athletic point of view, there's a number of different exercise modalities that might benefit from blood flow restricted exercise that no one's really investigated so far. So if we think about what it does, it's essentially creating a more stressful, more anaerobic environment within the muscle. Well, that sounds similar to a lot of types of training we might do to improve things like anaerobic capacity or repeated sprint ability. And these type of training adaptations might have some sort of a place for blood flow restricted exercise interventions. They might not, I could be wrong, but that's something I think at least warrants some attention.
Cool. And final question is, so someone listens to the podcast and the 1 or 2 people who listen to the podcast, they're very interested in your research, and maybe they want to get more information about how they could go about doing blood flow restriction, what they might want to ask their, if they're going to a gym and they want to ask one of the trainers there about this area, what they might need to know to ask the right questions or know if people are telling them the wrong things in the first place. How would someone get in contact with you to discuss this area of research?
Probably the easiest is via Twitter. So my Twitter handle is @Brendo_Scott. And yeah, I'll try to be more active on Twitter. I try to get on there. I don't post as regularly as I would probably like, but I'll always respond to any sort of questions if people are trying to get in touch.
Cool. Well, that is it. So that flew by pretty quickly. I do like the fact that you've given me, you're working on a new technique, which means I can lift as little as possible, and I can get some big old beach muscles when it comes time. As if you don't know what I look like, my arms are not.
Good thing this is an audio recording.
They're not the most pristine looking arms on the planet. But again, the information, the area that you're researching is quite interesting because I can see a lot of parallels to health and where muscle mass is important in health and where maybe we have individuals who can't lift or don't have, in fact, may not have the cognitive ability to lift heavy weights, and you might be able to use something like blood flow restriction to still maintain muscle mass and function. So just want to thank you for coming on the show. I hope you enjoyed the hour because it was some good, enjoyable content.
Great. Thanks for having me on.
That concludes another episode of Science from the Source. I hope you enjoyed this episode, and if you did, please take a minute to rate the show, and please help the show reach a wider audience by telling your family and friends. If you have any questions or comments about the content of the show or an idea for future episodes, please email me at sciencefromthesource, that's all one word, @gmail.com.